Hey everyone, what's up? This is Dr. Charlie PT. I want to shoot a quick video with some tips for you to help you determine whether or not, with some real proof here, not just based off of theory, whether or not strengthening your core, back, and or hips will be valuable for you. This video is specifically probably most valuable for people who have pain when they're walking for a certain amount of time and or when they're twisting. All right, so if you have pain when you're walking and or you're twisting, you're wondering, should I strengthen my back and or my hips? Now here's the thing, notice I didn't say, is it your SI joint? Is it your disc? Is it this? Is it that? If you want to figure out the most likely source of your symptoms, you can check out my free DIY diagnostic guide. Chances are you don't need some type of X-ray, MRI, anything like that, but instead using simple self-movement tests, you can figure out the likely source of your pain. All right, so if you have pain when you're walking and you walk like this, do you see that? Let's play that again. Come back. Watch her hips. Do you see how they kind of sway back and forth? It might look nice, at least to me, but then again, she's my wife, folks. You've got to be careful with that. So here's what that might indicate. Let's just say that you walk like that, where your pelvis kind of swings. Now, I'm not going to do it, but I probably ain't going to do it as well as she is. Can you tilt this down? So if you're walking and your pelvis does kind of this, when you walk, it kind of swings or it does a lot of rotation, anything like that, all right, and you're somebody who does a lot of twistiness, then here's how you can see and prove to yourself as well as everybody else watching that if you restrict that, how do we restrict motion in the body? Well, we increase the stability of the system so that we do less of something. We can block motion by either increasing the overall stability of the system, muscles in this case, core, abdominal region, back region, hip region, things like that. Or we could take some type of external device, which would be a brace or something. But let's just say you don't have any brace and you have someone like a husband or a wife or a partner or someone who's willing to put their hands on your hips, and here's what you could do, all right? So again, pre-test. Walk with your wobbly hips first. Something wrong with wobbly hips, by the way, okay? But if you have pain, consider, hey, I wonder if I'm just too wobbly in this kind of rotary type of way. Now you can come on back. After you see how that feels, then what you're gonna do is this. You need a buddy for this. So you're gonna have somebody, this is gonna be a little tough to see, so I might change how I do it, but you have somebody kind of take their hands on either side of your pelvis, okay? So here's kind of the top of the hip bones. On either side, they're just gonna give a gentle squeeze, and as you walk, they're gonna walk with you, behind you, all right? And they're gonna restrict that rotation. They're gonna give you a little compression, and instead of you being able to wobble, they're gonna kind of keep you straight and level, all right? So it would look something like this, and then I'll get out of the way and show you a different way, okay? So go ahead, walk. Now I'm right behind, and I'm keeping it nice and stable. I'm trying to walk out of the way. It's easier if you're right behind. Okay, now face the camera. So again, I'm behind. Go ahead, walk. Normal speed. You got that? Did you see that? Okay, so now, here's often what you'll find. If you have some type of rotary issue, again, notice I'm not mentioning anything about diagnostics. Might be SI joint, might be joint problem in the back, might be piriformis, might be disc. Who really cares? If you give stability to that system by walking behind, okay, like that, hands on hips, and you feel better with that, so it makes it feel better when you have more stability, then that gives you some credible evidence or proof to believe that, hey, isn't that kind of weird? When I walk, if I walk like that, it hurts. But when I prevent that, it doesn't hurt. That's really cool. So it tells you, number one, that your pain is changeable, and is changeable without some type of surgery or something like that. It's changeable just by somebody having them put their hands on you. But it's not feasible to walk around with someone having their hands on you like that. But it tells you, number two, it's the second thing, not only that your pain is reducible by restricting motion, but it tells you what motion you need to restrict. In this case, you need to restrict some type of side bend or rotary motion. All right, so if you can do less of this, right, or less of this, which by the way is very similar, rotation and kind of side bending are very similar as far as the mechanics of what happened in the spine, in the pelvic area, then you can probably improve your issue. So you could take a belt, something that might help you become a little bit more stable, but that's external to you. Why not just take your own body and move it in certain ways to give yourself more stability and or make yourself more stiff in that rotary position such that you can reduce your pain. All right, so maybe you did that walking test and you walked first to see how things felt without support, and then you had somebody come behind and kind of restrict any of that wobbliness and just kind of level things out, and you're still like, meh, I don't really know. I don't know if this is really helping to decide what I need to do or not. Again, the point of that test is to restrict the rotation, see if you have a rotational type of sensitivity or problem. Here's another test you can do. So you can just lie down, knees bent up, all right, feet somewhat close together, and all you're going to do is you're going to drop one of these knees out. Perfect, and back on up. And drop this knee out. Perfect, and back on up. Now, so what I want you to do, I'm going to move this closer, take your hands and put them right on your pelvic bones. All right, you got your pelvic bones, you can feel them, the little points?
Yeah.
Okay, drop this leg out. What happened? Back on up. Drop this one out. What happened?
I don't know.
Okay, back on up. Did you feel, again, it's not necessarily a problem, but did you feel a big wobble in your hands? What happens to your hands when you do this? That one's pretty good.
Yeah.
What happens to this one? Wobbly. Do you see that? So when she drops this leg out, watch what happens to this hand. Go ahead. Kind of pumps up. Do you feel that? It pops up.
This one feels more flexible. Like it
Okay.
feels easier.
Cool. Okay, do this one.
This is stiffer.
Great. Now you might be saying, Charlie, who really cares? Well, here's why I care. So what it tells me is that when you rotate the leg a certain way, it tends to pull your pelvis with it. When you move your leg, it tends to rotate or pull on the pelvis, all right? Now, of course that would happen, but what you'll see is that that might be painful. Remember, we don't care so much that it's wobbling. It might be normal when you drop your leg in a certain way that it wobbles. But if you drop your leg and you notice that, hey, on this side when it doesn't wobble, her hands did not move, they stayed level. Think of this like a boat. But when she dropped the other way, ooh, she got a little bit of a spin or a twist in there, and then she said, ouch, that's painful. Number one, tells me when she gets rotation in her low back and or her pelvis somewhere, causes a little bit of an issue. Now what I say is, hey, when you drop this leg out, can you not let that happen? Keep your pelvis level. Perfect. And if then, she says, this is the kicker, if then she says, you know what, that takes away my pain too. I don't feel pain when I do that. When I prevent the rotation, I feel no pain. But when I just let it flop and I get this kind of weird twist, the pain comes back, right? So you see how we're like testing motion, and we put her into a test which kind of looks at some of the tendency to rotate her pelvis. And when she dropped this side, there was no twist and no pain. Again, this is an example. When she dropped this side, you can see again that little bit of that shake, right, where her pelvis wants to tilt that way, all right? And if that's painful, and you experience pain when you're dropping your leg one side or the other, but then when you restrict and you kind of keep the boat level, the boat from rocking by, how do you do that? Well, you have your hands for feedback, and you can kind of contract your abdominal region a little bit, and you drop the leg out, and you don't prevent that little twist, and you focus on the control of the leg drop. And then if you have no pain, tells you you might have a rotation problem. Again, some type of stability work and or abdominal work in the rotary plane, challenging the rotary plane for another video here might be valuable. 2 other tests just because I'm on a roll, okay? So go ahead and do all 4s, hands and knees. All right, so for this next test, all 4s, hands and knees. So you can see from the side. If you like that, all right. You're gonna do like a little bird dog. If you have back pain, well, McGill knows everything, right? So therefore, you're probably doing some McGill stuff. So go ahead and show me a bird dog. Do you know what a bird dog is? It's where you take, okay, that leg.
This one?
Perfect. Okay, good. Now you've got a good shot. All right, do it again. Cool. Okay, right there. What did you see? The person watching. Her whole hips went this way. Do it again. And there's a little bit of a twist, right? Go ahead, let it down. Do it again. Right? So she rotates a little bit off axis and she does a side shift. Right? Now, no big deal if you don't have pain, but if you have pain, you're saying, ooh, that's kind of yucky. Then if we correct that, what happens? So what we could do is this. Take some type of external cue, like a ball. Go ahead and drop this down slightly. Okay, the ball's there. Don't let the ball drop. Do bird dog.
Right now?
Right now. Very good. Now do you see the difference?
Oh.
Ah! It was close. But you get the idea. If a ball doesn't work, very good segue, you can use some type of maybe foam roller. All right, go ahead. Perfect. And you can see how this stays pretty level. Now do it your old way. Right. You can see it tips, right? And so again, we don't really care so much about the wobbliness per se. But because if you're watching this, you have some type of pain, then we want to ask ourselves, does that wobbliness play a role in the symptoms that you're experiencing? And if you do it the wobbly way, and you say, ow, as I side shift and as I have this rotational element in there, it kind of hurts. But when I don't do that, do it again, it feels much better, then again, it's another piece of evidence that this rotation needs to be something that we remove and or we limit in order to allow your body to heal. And you can do that externally with bracing again, and or you could train this with different types of feedback, all right? And here's the cool thing, another little nugget. What do I do for exercise? We'll shoot another video on this, but like you could take these tests. They hurt when you do them one way. They feel better when you do them another way. You could take the test and do it in the way that feels good and just practice it over and over again. Okay? Now, one other thing is you could take also like a normal foam roller. You could put it on the back. Just something else to think about. Show me the other side real quick. So you did this side. Show us this side. Cool. Do the other side now. That side looks harder.
This one's harder.
Yeah, that one's funky. So you can see when she does it side to side, when she, do the hard one. Yeah, I think it was this leg up. When she kicks her right leg back, she does this whole rotational thing. You can see she's a little more wobbly. And when she kicks the left leg back, she's pretty neutral, right? So kick the right leg back again. Right, so you can see there's just a lot more twist, if you will, to the pelvis when she does that. Again, not necessarily a problem, but if it's painful, and then when you restrict that rotation, it becomes non-painful, another sign and or another test to kind of say, hey, seems like something I'm going to want to correct and or work on. Final test. All right, final test. So getting kind of this clamshell position, right, and see the way she's all lined up. So straight line, that's the idea, as if her heels, her butt, and everything were kind of straight on a line there, okay, or on a wall. And what you're going to do is this. Go ahead and keep your heels together and just open your legs. Cool. Keep going like that. That's great.
I didn't know I was going to be working out here this morning.
Well, now you are. Keep watching, folks.
Am I doing something wrong?
Do it. It's good. Now put your hands on your hips. Don't limit anything, but just put your hands there. Go ahead, do it. What's happening?
I'm rocking backwards.
She's doing a lot of twisty. You got a twisty pelvis, not a twisted pelvis. She just likes to twist. Now here's the thing, she doesn't have any back pain, so we're not going to correct it. It's not a big deal. But if you have back pain and you're doing it and you're noticing all this kind of wiggling and rolling when you do it, and it hurts, then maybe you have twisty pelvis problem, rotational problem. And we can train you to not do that. How? Put hand on hip, and now that you have hand on hip as feedback, open legs, but prevent yourself from rolling. Very good. Do you see the difference? Is someone watching? So it limits her motion a little bit. She can't go as far, but now her brain and her body, she's really having to concentrate to not do all that twistiness. Does that make sense?
Yeah. Mm-hmm.
And if when you prevent the twist, you say, wow, that feels a lot better, then again, I don't know how many tests we went through, probably 4 tests, I think. It gives you the 4th piece of evidence that you need to say, wow, I need to train that. I've got a rotational problem in my back or my pelvis, and if I can improve that, given the evidence, remember the 4 tests, what do you call that test?
The supported walking test?
Supported walking test, all right? The wobbly walking, the anti-rotation walking test, all right? If that felt better, that's one piece of evidence. Ding, might have a rotational problem, maybe you want to work that out. Second test was, bent knee fallout test to see if your pelvis really rocked when you drop that out on your back, all right? Third test was bird dog test to see if when you lifted things up, you got real wonky on one side versus the other. And the fourth test is kind of this clamshell test, right? It's basically kind of like the bent knee fallout test, but in this case, we're just kind of doing it a little bit against gravity to see what muscles your body kind of wants to use, and or scratch that, the way that your body wants to move to accomplish the task. And it wants to go right to wobbliness in your pelvis versus being able to kind of just isolate that muscle. Now, again, muscles don't work all in isolation, so I'm not saying that's her problem per se, but I am saying that if when you test it your way with the wobbliness, it hurts, and then when you prevent that wobbliness or rotation or twist, it doesn't hurt, then I don't care the problem. There's some type of rotational problem, and we have evidence to believe because we just tested, inputted, and kind of retested or got your feedback that when you prevent that rotation, it helps. And therefore, you're going to want to do things that limit that rotation. That gives you all the evidence in the world to believe that that is potentially part of your solution. Does that make sense?
Yeah.
Cool. Okay. So hopefully this was useful. If you found it useful, let me know in the comments. If you have other questions, also let me know in the comments. Be sure to hit the subscribe button as well as the bell for notifications when we go live every single week. And hopefully this was valuable for you. If you have trouble walking and or trouble doing things that involve twisting, maybe rolling over in bed and or sitting when you twist, things like that, chances are you might have some type of rotational problem in the kind of back or pelvis. And you can see when you test, and then when you do something that, and you hurt, and then when you do something that prevents that rotation, if you can reduce your pain, because again, that tells you sort of what you need to do. Now, how to go about exactly doing it, again, that's topic for another video, but hopefully this gave you some insights and some clues as to what you might respond to. So that's all I got. Thanks so much for watching. Until next time, I'm out. See you later.